Dr. Amani Safat, had PhD in clinical psychology from Edinburgh University in the UK. I was trained in the National Health of Scotland, and now I'm lecturer and clinical psychologist at the British University in Egypt. I'm going to talk about cognitive processing therapy as treatment for post-traumatic stress disorder among Syrian refugees. More than 500,000 of people have been killed or are missing because of the war in Syria. People fled to Turkey, Iraq, Jordan, Egypt, and Lebanon, and North Africa, such as Algeria, Morocco, and etc. Since 2011, the Syrian civil war has driven millions of people to flee because of the bloodshed and violence there. Therefore, several people suffered from mental disorder, such as anxiety, depression, frustration, feeling worthlessness, feeling unsafe. Post-traumatic stress disorder was shown to be prevalent among Syrian refugees, as showed by studies conducted in Turkey, Lebanon, Germany, Jordan, and Egypt. Syrian refugees may be nearly 10 times more likely than the general population to have post-traumatic stress disorder and other mental illnesses. As defined by DSM-5, 2013, post-traumatic stress disorder is a type of trauma and stress disorder that develops after experiencing or witnessing stressful, frightening, or life-threatening experience, such as combat, war, and catastrophes. Post-traumatic stress disorder is characterized by intrusive, avoidance, hyperarousal symptoms, and alteration in cognition and cognitive function, such as memory, concentration, thinking sometimes, and most of the cognitive processes and functioning. Plus mood alteration, mood swing, and feeling sad, sometimes feeling anxious, plus the whole dysfunction and whole problems in quality of life. Psychological consequences of trauma could be in the form of body aches and pains, emotional suffering, destructive thoughts, such as committing suicide or hurting themselves by taking some substances or taking some binge eating, or any risk and dangerous behavior, destructive behavior. So trauma caused negatively impact on the quality of life, deterioration in the most of the activities, pleasure activities, social activities, and academic activities, feeling guilt, feeling ashamed, feeling worthlessness, having destructive thoughts and behaviors about self, others, and the whole world. So post-traumatic stress disorder includes stress, anxiety, depression, lifetime expended danger of misery and sadness. Many guidelines recommended the most beneficial treatment or intervention for the post-traumatic stress disorder is a trauma exposure, such as prolonged exposure and cognitive processing exposure, cognitive processing therapy, and cognitive behavioral therapy that focused on the trauma. Recent study found that psychotherapy is more effective than medication for the treatment of post-traumatic stress disorder. So we chose in this study to conduct cognitive processing therapy as a treatment for the post-traumatic stress disorder. So the cognitive processing therapy includes help patients to become aware of their feelings, their PTSD symptoms, learn new skills to challenge their thoughts, and especially destructive thoughts, problematic thoughts, and stuck points. Learn how to change their beliefs about post-traumatic stress disorder. Cognitive processing therapy was developed by Patricia Rizek in 1990s. It combines cognitive processing therapy and trauma processing, trauma exposure. It's very well established and manual, and it has very specific manual for treatment of post-traumatic stress disorders, and it includes between 12 and 24 sessions of the cognitive processing therapy. So our aim in this study to investigate the effectiveness of cognitive processing therapy in treating post-traumatic stress disorder, depression, and anxiety among Syrian patients. The study was clinical trial, but it has only one arm. People, and we are going to assess them before and after, and then 1 year later. The time it was conducted between 2017 and 2021. Population, the inclusion should be Syrian, age between 18 and 65, and suffer from post-traumatic stress disorder because of the war specifically. Have good knowledge of English language because all the assessments, manual, and therapy handouts in English. Exclusion, psychopathology disorder, for example, mental retarded disorder, or schizophrenia. And then we conducted CAPS, or clinician administered post-traumatic stress disorder scale, before the intervention, after the intervention, and then 1 year later. The second assessment was PCL, or post-traumatic stress disorder checklist. This was conducted weekly. While the patient in the waiting room, we asked him to, or her to, fill the PCL and to fill the BDI, big depression inventory, and to fill big anxiety inventory. So weekly, we ask the patient to conduct PCL, BDI, and BAI. Plus, the CAPS was conducted by clinician before the intervention, after the intervention, and 1 year later. 1 year later, BDI was conducted as well, and big anxiety disorder, big anxiety inventory was conducted as well. The sample size was 94 patients, Syrian patients. They came to the clinic seeking for treatment for their symptoms because they couldn't live well, they couldn't have good quality of life, they suffer from depression, they thought many times of committing suicide and ending their lives. So data management were in the British University drive, and then the ethics was a protocol, institutional review board of the British University was agreed and approved, and then it was registered in clinical trial website. It was with all the ethics guidelines of good clinical practice. So the CAPS pre, after, and 12 months later, so the PCL, BDI, and BAI. There was 61 female and 33 males. Most of them were between 15 and 25 years old, most of them, and they were married, 33 of them, and 60 were single. Most of them, they had university educational level, and then current employment were full-time job, they have their own jobs. The physical health was very good. Between we mean by it, there is no chronic illness in their body. About the craving food and or drugs, slightly, not a lot, especially the painkillers. The social support, slightly, but not a lot. The income was equal to expenses or sometimes lower than expenses. The severity of the trauma, extremely, they classified as extremely hurting trauma. Most of them more than 1 or 2 years. They recently came from Syria. The place of birth from Idlib, the majority, and then from Aleppo. They most of them, they don't use any substances to escape mechanism, but sometimes some of them use tobacco, cigarettes. Very few take alcohol, only 2, 6 canapes, but not a lot. So the results showed that Syrian patients suffer from severe post-traumatic stress disorder. The mean on the CAPS was 49.5. Their depression were 38.6, and their anxiety was very high because they don't feel safe, they don't feel secure, they don't feel settled yet. It's their mean on the BAI, it's 41. So after the intervention, the results on both CAPS and PCL suggest that cognitive processing therapy is an effective treatment for post-traumatic stress in Syrian patients. It was a significant difference among before and after and 1 year later. Cognitive processing therapy appears to be successful as well in dealing with the depression. It was a significant difference as well. According to anxiety, big anxiety inventory, there was a significant decrease as well in their scores. So this is the weekly assessment. There is, according to the post-traumatic stress disorder, according to PCL or post-traumatic stress disorder checklist, the first 3 or 4 sessions, there wasn't a lot of decrease, and then decrease start to begin till the session 12. And then after year, there is a little increase, but not a lot, between 32.8 and 33.2 on their scores. Regarding the depression, it was difference from 38, their means, through 28, 10 scores on the BDI. And after 1 year, there was only 1 score drop in their means. And very similar to the post-traumatic stress disorder scored, the first 3 sessions or 4 sessions, still there were no decrease in their scores, and then started to decrease slowly. About the anxiety as well, it's very surprising results, because after the 4th and 5th, the 4th was drop, and then it came back but it's still not a lot of decrease regarding the anxiety. It's significant, but I consider it not big difference, because between 41 and at the beginning before the intervention and 37 after the intervention, it's almost 4 scores on the BAI. So they still feeling severe anxiety, but they have improvement, much improvement in post-traumatic stress and in depression, more than the anxiety, but still significant. The conclusion, cognitive processing therapy can be useful treatment intervention of treating post-traumatic stress disorder, depression, and anxiety symptoms. Depression, anxiety, and post-traumatic stress disorder have a strong link. Research in the future should include co-current integrated treatment, because maybe to have more improvement in the anxiety, for example, to have more improvement in the feeling ashamed or worthlessness, or there is no meaning of life. This is the references. Thank you very much, and thank you for having me. Thank you for listening to me. I'm happy to have any question if you want. Thank you so much.